Thanks everybody for hopping on tonight. Excited to introduce Tapley Holland. He is the developer of the TruDose patent pending technology. As some of you may know, we have done an initial round of treatment in our office with Dr. Farrell assistance. We did kind of a pop-up clinic. We've treated 14 patients. We are launching this in our practice next month. So I'll turn it over to you to share more about this in detail, and then I think there's probably going to be a lot of questions.
You got it. Okay. Let me tell me when you can see this. Shake your head when you can see this. Okay. So the easiest way to go through this is I never know what types of patients I'm getting. There's some who really want the crunchy science. There's some who really wants to know kind of the story of how this came to be. So I created this presentation to kind of summarize everything. And Mollie, if there's something that I'm going too fast, please slow me down, because I'll try to go this pretty quickly so everybody can ask their questions. But this is a presentation I gave to that conference, Mollie. You were at this a couple of weeks ago, and like all presentations, my disclosures are that I created the technology, I uncovered the therapy, the IV therapy, and people always want to know what my background is. And I don't have a biochemistry background. I don't have a PhD, and I'm not a doctor, but I'm just the guy who figured it out. And I'll talk about what I figured out. And if you want to know how this came to be, people always ask me, well, how'd you figure that out? Now, let me back up. I've been in the stem cell industry for over 20 years, but I've never done any formal research. And so people ask me, well, how did you know? I said, well, I have a photographic memory. So it made me really successful as a sales career when and my specialty was stem cells. So if I can read stuff and I can catalog it, it made me really effective in front of doctors. And the story of how this came to be is not really, I can answer it later, but to summarize it, this came to me in a dream. And then the following morning, I woke up and said, I need to create this software. If anybody wants to read all the references, what I'm going to go over in this presentation, there they are. And so what I want to cover is, what is PRP? How do you create it? Why PRP, or any stem cell therapy, not just PRP, but why do stem cell therapies in general work for some people and they don't work for other people? Then that led to me creating TruDose. Then that led to me uncovering the IV therapy. And then this basically uncovered what we were not taught about platelets that are circulating in our bloodstream.
In the movie.
So what is PRP? It's a regenerative therapy, and it's from you. It's using your own blood. And like all stem cell therapies, you take blood from you and you concentrate it in a centrifuge to create, in this case, a concentration of your platelets over your baseline blood count. There's 30 years of data on the use of PRP. It's arguably the most studied therapeutic that exists within the medical literature. And the applications are really for sports, dental, wound, and hair. That's how we've come to know it. And only to be administered site-specifically. What I uncovered is it goes way past sports, dental, wound, and hair, and it goes way past injecting this site-specifically. We're going to do this intravenously, and how this is basically unlocking Pandora's box of your body's ability to heal. Now, how do we create PRP? If I took a volume of blood from you, and this is an example. This is a volume of blood placed into a canister, and I put it into a centrifuge. And I centrifuge it for a few minutes, and it separates out based on its weight. And this is what you have. You have your red blood cells, and basically everything else that's lighter than your red blood cells goes to the top. I take everything else, and I put it into another canister, and I process it again in a centrifuge. And that centrifugation process is nothing fancy. But eventually you get concentrated platelets and your lighter plasma, which is basically your blood. The water content of your blood. Now, this is not just PRP. This is how you create virtually all stem cell therapies. Heavy cells fall to the bottom, and then you have the lighter stuff, which you take off, and you give the concentrated cells or the concentrated platelets back into your body. Now, why does PRP have a 50-50, or really stem cell therapies in general have a 50-50 success rate? Because like I told you, it's the most studied thing that exists within the medical literature. But if you read this comment right here, this summarizes perfectly that we've never really figured out the ideal concentration. Or another way to say this, we've never figured out the right dose to heal what? The right dose to heal my knee, the right dose to heal my Lyme disease, the right dose to heal whatever. And so if I don't know the dose, then how are we ever going to really understand the potential of the therapy of these therapies using cells from our own body and what they could potentially heal and cure? So that's something that that this would be considered dosing and accuracy problem. And if we don't know the right dose, again, whether it's stem cells or it's PRP, if we do the same thing to everybody, then our therapies are going to be inconsistent and variable because we're dealing with biologically different people. And again, if we do the same thing to everybody and we expect, and everybody's biologically different, should we expect everybody to have the same results, right? Hopefully your head is shaking no, but that is how we've done stem cell therapies and PRP for the past 4 decades. And so what you end up is, well, is there a dose that's too little? Is there a dose that's too much? Is there the right dose? Okay. And that's kind of what I figured out. So in 2018, I had a dream, and in that dream, which is another story for another time, I was downloaded the intelligence to come up with the TruDose technology, which is this. And what the TruDose technology is a software that I created to determine what is the right dose for the right disease condition, specifically for you, to make it work, consistently. And so what we have to do, if you walk into an office, they would take a finger stick and they would measure a few drops of your blood. And that blood is measured right there in this little cell counter that's mine over here to the right, if you can see it. And the software, after that blood measurement is done, the software takes that measurement and says, okay, you came in with Lyme disease, fibromyalgia, whatever. And for you, instead of just drawing, 30 mils of blood for you, and then 30 mils of blood for the next person, and 30 mils of blood for the next person who walks in, we're going to make sure we determine how much blood we draw from you. And again, you walk in the door, a finger stick is executed, you take a few drops of your blood, it's measured in that analyzer right there to the right. It goes into the software to determine, for you, we might need 85 mils of blood. For the next person with fibromyalgia, we might need 185 mils of blood. For the third person, we might only need 33 mils of blood. But each person is going to get the right dose based on what the software I created determined, basically over the past 5 years of me doing this, and close to 10,000 patients later. So everybody with the TruDose is going to get a personalized dose, a therapeutic dose. It's 95% accurate if you test and you measure and you use the software. And the whole process takes about 45 minutes from the time you walk in the door, from the time it's given back to you. Okay. Now, when I started doing this, I was just trying to solve problems like this, make my hair grow. And you can see right here that, if you do it at the right dose, one treatment, it'll make your hair grow. What changed everything for me was in 2018. To make a long story short, I was sitting in an airport, and kind of like the software dream idea, I was sitting in the airport and the idea was given to me. I called my wife and I said, hey, I think I know how we're going to heal Andrew, who was our 5th child that was vaccine injured and became autistic. And I said, nope, we're not going to give him stem cells. Despite that, I am pro stem cell. I said, I think if we give him a high dose of concentration of your own platelets, I think it's not only going to heal him, I think it's going to unlock his brain. And so like everybody, like all autistic moms who are searching for answers, she was the test pilot, and she was patient number one, because anybody who knows anything about autistic moms who are searching for answers, they if the treatment helps them, then they'll give it to the kid. If it doesn't, then they won't. Now the story of why my wife would even trust me with that idea in the first place is another Zoom call, or maybe somewhere can be asked later. But just assume that my wife trusts me, and she says, well, will my dad be on board with this? And her dad's a doctor. And I said, no, there's no way he's going to be on board with this. And nobody would conceivably be on board with this. So I had to go home and I had to lay the literature out in front of him as to why this would not hurt his daughter. And we did it to her. And the next morning, it did exactly what I thought it would do, which is it unlocked her brain. Her brain was literally moving. Her mouth was literally moving at a pace that her brain was moving at a pace that her mouth literally could not keep up with. Her vision got better. The tinnitus in her ears went away immediately. Her stress incontinence went away. And it did all these things to her that over the course of 8 weeks. The second patient was my second child, who was borderline dyslexic, because at this time I didn't put two and two together. And to make a long story short, not only did it fix her dyslexia, this child thrives at reading. Before the treatment, she tested below grade level. Now she's at mastery. And now all my kids have had the treatment, and they all read at a mastery level. So again, in 2018 in October is what changed fundamentally everything that I sought out to do. And that's when I came up with the IV platelet therapy. And that's when I patented and I coined all the different words and got to see over from 2018 into now, which is close to 10,000 patients later, I've basically uncovered a treatment that is helping reverse many conditions that conventional medicine considers incurable. And so the question is, how is this doing this? That's what most people want to know. How is taking my own blood, I get the right dose, but putting it back in, how is that conceivably working? And so this is what I'm going to go over right now. This is a picture of your platelets. And if you were to Google, right now, what do your platelets do? What you would find on the internet is that we've been taught that your platelets are largely existing in your body to make sure that we don't bleed out. They clot. That is, if you ask anybody. And so I showed this slide at the doctor conference, and I read it to them. You can read it right here. I said, in many diseases, substances are formed which act as irritants or poisons to the platelet-forming organs, and depending on the intensity of their action, may exert their influence either to increase the platelet count or reduce it. And then I said, can anybody guess when that quote was written? And nobody could. And then I flashed 1915, and I said, I just want you to take a step back and just understand this was written in 1915. So it might go to the heart of what have we missed over the past 100 years of what our platelets are doing in our body. And so I'm going to skip through the rest of this, or some of this, and I'm just going to give you just some high level for some people who want to know this, because I want to skip to the part to how it's doing it. But your platelets are basically born from your bone marrow. They're derived from your hematopoietic cells, and your platelets are created in your bone marrow, but they're also stored in your lungs. And the cool thing is that when they go to your lungs, your lungs or your hematopoietic cells turn the platelets into big ones and into small ones. Okay, why? Because now we know that platelet size, big ones or small ones, now points to basically what type of disease you might have. And so I want to focus you in on this one. Larger platelets are packed with more weapons, more viral killing weapons, more bacterial killing weapons. They're packed with more repair things, like repair things to create new blood vessels, repair things to create new nerves, repair things for all types of things I'll get into. And so our body, this is the coolest thing. Our body was created to make platelets from the bone marrow, strategically place them in the lungs to respond to different stressor events that might happen to us based on pathogens or viruses or COVID or whatever the inflammatory insult. So at any given moment, our platelet could release these things strategically based on where it's happening, but not just in our lungs, but also in our spleen. So our spleen contains 33% of our larger platelets. So think about this. At any given moment, if something happens to you, like COVID virus, your body's going to deploy platelets from your lung, platelets from your spleen, and it's going to manufacture new platelets from your bone marrow. So it's going to go to work and attack, in this case, the COVID virus. And your platelets are being turned over at a rapid rate. So if you look at this one, the second bullet, at about 70 million platelets per minute. And so the takeaway is, depending on the particular thing that's happening to you, your kid, your husband, whoever you're on this call, will determine the rate at which your platelets are turned over, the size at which your body will make them, and then what it's actually carrying on itself to actually fix you. Okay? I mean, there it says it all right there. This is the quote from 1915 as well. So, okay, now let's get into how it's reversing these conditions. So just imagine your platelets not just circulating your bloodstream looking for things to clot, but they're circulating the bloodstream looking for two things: what to repair and what to kick out of your body. Okay, so they're surveilling your bloodstream with all types of receptors, all types of weapons, and all types of repair packages to fix what's going on at that given moment. For example, your body's carrying around 95% of your body's serotonin. Now think about that. Platelets don't make serotonin. Serotonin is a critically important for all types of bodily functions. But your platelet was created by God, and it was selected to carry around 95% of it. Why? Because at any given moment, it's got to hand this off to the cells that need it, to the organ that needs it. It's also carrying around 99% of your body's brain-derived neurotrophic factor. Now, for anybody who's got an autistic kid or a stroke or anything neurologically impaired, you kind of need this because it's the one thing that recreates new nerves. Or if you have any type of demyelinating disease, you need this growth factor, and guess who carries it around? Your platelets. So, because at any given moment, when something happens to you, your cells throw out these status reports in their bloodstream. This is what's happened to me. This is the extent of my damage. And your cell will throw this status report out in the bloodstream, and it will close down its cell wall to protect itself. And these status reports, the acronym right here is called the Damage Assessment Molecular Pattern. That's basically, again, a status report of what's happening to your cells at any given moment. And so these are all the types of things your cells can throw out into the bloodstream of things that happen to them. Okay, for example, heat shock. If you come under like major, heat stress. But guess what? Guess who's carrying all the receptors for all these different damage things that can happen to your cells? The platelet. So it's surveilling the bloodstream, looking for things to actively repair. Okay. And I want to clue you guys in on this. What about viruses, bacteria, fungus, mold? Well, those are pathogens. Okay. Now I want to focus you in on the two things I just circled, which are pathogen recognition and then also pattern recognition. So just think of those two words. Pathogen recognition, that's the ability to recognize a mold from a bacteria from a virus, and so forth and so on. Platelets are carrying around these receptors to know, like, you're a virus, you don't need to be in the body, I know what to do to you. But it's also carrying around pattern recognition, because any given virus can, the flu virus from last season is going to act on us different from this season. That's a pattern. What is it doing to me? How is it trying to affect me? How is it trying to break down my body? That's pattern recognition. So if you just look at that right there, that just screams to me how intelligent we were created, but how intelligent this little thing is that we know nothing about. Again, the platelet. And here's an example of, I just want to, this is a platelet, and these are these receptors that are actively seeking out all these different viruses. And you can see that, there's nothing that the platelet doesn't know anything about. HIV, Epstein-Barr, cytomegalovirus, Coxsackie. So not only does it know the strain, but it knows the family of the viruses. So we're always going to come in contact with viruses, but this is the one thing giving this treatment can reset and recalibrate our ability to recognize these viruses. Okay, now, so how is it going to fix your particular disease? So I want you to not think of like, will it help autism? Will it help cancer? Will it help Parkinson's? Will it help all these things? The short answer is all of these particular conditions were the result of inflammation many, many times over. And what I mean by that is that these two circles represent the order of events that our body goes through to repair anything and everything. Okay. This is step 1 of our repair system. This is step 2, step 3, step 4, and so on. And when it completes this cycle of a particular repair event, then the body will enter the sleep cycle. Okay. And your immune system acts the same way. It has a system and order of events and how it clears a virus, a mold, a bacteria. And guess who starts both of these systems to activate? Yes, the platelet. So the platelet is actively surveilling the bloodstream, looking for things to activate the repair system and the order of events to repair it, and the immune system and the order of events to clear it. But what happens to many of us, if you can see right here, is that it can be for any number of reasons. A lot of them are environmental, diet related, and so forth, that many of us will get stuck at a particular point of the repair cycle or the immune cycle, trying to clear out the virus or trying to heal the brain injury. Okay. And your body will not let it progress forward until it has the information or the resources needed to go from step 2 to step 3, from step 3 to step 4. Your body will not let it move forward. And so what happens is that let's pretend this is my brain. My brain for this particular injury will stay stuck at step 2 in this feedback loop of inflammation until my body has whatever the resource it needs at the cellular level to progress forward to complete that healing repair. So this is an inflammatory loop, an inflammatory cycle that my body simply will not progress out of. And the same thing will happen to my immune system. This is why we have these, mast cell activation. So you take a singular event and you start stacking them on top of one another over a lifetime. And this is what we've learned, and this is also validated through, studies. This is how you lead from simple inflammatory type diseases into more progressive peripheral related, meaning they're more, they're more in the blood, affecting your blood vessels, like Raynaud's or, obviously heart conditions, hair loss, sexual dysfunction, Crohn's disease. And then those progress forward to your chronic neurological. And if you can see here, they start to, this is how we get mental disorders, fibromyalgia. So these things are acquired. Now, I wanted to see if I can have so I can acquire these things over a lifetime of unresolved repairs or unresolved immune clearances, or I can be thrusted there immediately, like my son was, from a singular event that caused so much damage that it flashed forward him from inflammatory to neurological when he had that vaccine injury. Okay. So here you are, you have all these things, unresolved issues. Your body's coexisting with these things. It tried to fix it, but it can't now. It's coexisting. And your body has prioritized importance, meaning it doesn't care that you can't walk with the joint pain. It's gonna focus on neurological. It's gonna make sure your blood can pump and make sure you can breathe. And then your other organs are basically gonna be, somebody's endocrine function might be more important than their thyroid. For another person, their gut function might be more important than their pancreas. So everybody's basically order of priority in the organs and what their body is going to be individually specific. But you just have symptoms and diseases. And so I'm going to give you 4 reasons how this is reversing it with this IV therapy. And then I'll stop my part and then open up for discussion. So the first way this is reversing it, again, I take my blood out, I'm processing the centrifuge, and I'm giving it back to you back into your vein where it came out from. This is reason number 1. Number 1, your body is once I take the blood out, your body is already manufacturing new platelets. Again, earlier I told you your body's manufacturing 70 million a minute. So by the time you've done this treatment 45 minutes later and you're getting your injection, your body's already repurposed that amount that you lost. So now you give yourself back a super dose treatment. So you have your platelets that you lost, and now you've given back this super dose amount of platelets that your body has to do something with. It's like, great, you just opened up a wealth of surveillance drones to go figure out a bunch of things that need to be repaired or the immune system needs to be restarted. Okay. The second reason I'm going to give you, this is kind of like a preamble. This goes all the way back to Hippocrates, that our body maintains health and disease or pain based on proportions or ratios of things to one another. Okay. I'm not making this up. So the second reason that this treatment works is that when you put this super concentrated amount of dose specific platelets back in your bloodstream, it's changing the ratios of your platelets to your white blood cells, your platelets to your red blood cells, your platelets to the different hormones circulating, the cells in your bloodstream, the neurotransmitters, etc. So think of ratios as 3 platelets to 1 red blood cell to 1 white blood cell. Well, you stick back in, 70 billion platelets, you've just altered the hemodynamic ratio of platelets to everything else in the bloodstream. And your body goes, whoa, I don't have to metabolize this like a drug. I'm going to put this to work. So it's changing the ratio. The third reason is that the information is being reset. Again, your platelets are circulating, looking and starting your repair system and immune system. But you have all these unresolved repairs, whether it's autism, Lyme, fibromyalgia, that your body's coexisting with. Okay. And so the technical term is called immune recognition and repair recognition. So right now, your platelets are responding to all the different stressors in your body right now, listening to me on the Zoom call. I take a volume of blood out of you, and those platelets are in that blood bag. They're not being stimulated by anything in your body right now, the ones in the blood bag. If I just put those back into you, their whole information is now going to be re-stimulated when it goes back into your bloodstream. And that's called resetting your immune and your repair recognition. So, and the way that I describe that to people is, imagine you live in a moldy house, but you don't know that it's moldy. You leave to go to the beach for 2 weeks and you come back and you're like, wow, what does that smell? That's immune recognition. So now your platelets say there's no more coexistence. That virus over there, you're not living in the body anymore. That repair from the brain, let's get on this. And your platelets are going to look at your whole body systemically and say, what's important? I can tell you right now that it's going to look at the brain, the heart, and the lungs, as the top three things. Ooh, my PowerPoint went ahead of me. And then again, for the next person, it might be their thyroid. The next person, it might be their pancreas. But those three things will be at the top. But what it fixes after that will be dependent on you. I can tell you the last thing that it's going to be concerned about is your hurt knee. So it's resetting your information in your bloodstream. And so when you so your platelets are going around and going all these unresolved repairs and immune clearances and saying, oh, wow, you know that information that you needed, those resources you needed? Well, here you go. I'm going to give it to you. Here you go. I'm going to give it to you. And now this thing can complete its repair cycle, complete its immune clearance. And now that thing is done. And just by completing that repair thing that you had maybe 3 years ago, maybe it was a concussion you had when you were 16, repairing that unresolved repair that you didn't know that you're not dealing with is going to fix a problem that's led to where you are right now. Fixing a virus that you've had in your body for 30 years, getting it out of the bloodstream is going to start reversing all of these unresolved immune clearances and these unresolved repairs, and it's going to reverse you back up that ladder I showed you. Now, the fourth reason, and this is more theoretical than anything, but it makes complete sense to me. This is some new evidence that has come out, and these were people that are used AI technology, and they imaged the platelets, and they look in the DNA of the platelet, and they looked at all these proteins and molecules inside the platelet, and looked at all these cool, functions that are in the platelet that you can read them right here. Everything from glucose metabolism, basically things that are part of functions in the body. And they identified close to 2,500 proteins and molecules that they didn't know that we had that could possibly be related to health and diseases that can be fixed. Now, when I read this, what I took from this is this. This is theoretical, but because your platelets are not nucleated cells, they don't have a nucleus, nothing about them is opportunistic, no virus wants to kind of go after them, then there's nothing about them that wants to be hijacked. And so they haven't, that genetic code that basically this study has uncovered is saying that there's all this genetic material that hasn't been altered to the generations from my grandfathers to my mom to me. So possibly all of these epigenetic modifications that have led to my condition now, to my son having a peanut allergy and he's 2 years old, or mast cell activation and I don't know why I have it, that this is a possible reason that, and we know that viruses little by little can alter our genetic code, then this is possibly going little by little and recoding altered DNA material within our cells. It's giving them the material and saying, oop, let me reverse you back. So that, again, this is a fourth reason. It's more theoretical, but it makes complete sense to me. So to summarize, it's your blood, it's your platelets, using your own intelligence to reset and restart all these systems to help you exit out of these loops. And eventually the symptoms will alleviate, and eventually your system, your condition will reverse. And so I'll stop it right there, Mollie. And so again, this is atypical than my typical Zoom call, but over the past 4 or 5 of these I've gotten this flood of patients that are more knowledgeable, that are more scientific, and they want to know the why. And so I just gave you all the literature right there in a very kind of like blasted format.
Thanks, Tapley. That was awesome. I think that was just the right level of science and like layman's. So should we go to some questions? I see a comment in the chat. Let's see what that is. So in doing treatment, does anything help make it work better? So is there anything to modify before and around the treatment to make it more effective?
Of course. I mean, and then that's definitely something you would do with Dr. James, right? if you do this treatment, will it help you? Sure. But if you keep having an inflammatory diet, it's eventually going to, you're slowly get back to the same part you are right now. Better said, if I work with Dr. James and I'm doing things like an inflammatory diet modification, and I'm doing other types of modalities in conjunction with this, then yeah, this treatment is going to expeditiously heal where other modalities fail.
Yeah.
So it helps them work. It helps the other modalities work better.
So a couple of things that we did practically, and you can correct me if I'm wrong. So the papaya leaf extract to help stimulate more platelet production.
Right.
We want to make sure there's thorough testing to look for reactivated infections and treat for those ahead of time or mitigate any Herx reaction. We had a couple of people have that. And then we did some ivermectin a couple of days before also with the last one. So
yeah. And some people, and so does this mean, I get this question asked all the time, does this mean, somebody's lived with Lyme for 30 years. Sometimes you just don't have 3 months to go through, of just all these modifications because this person is in severe pain and they need answers now. Well, you have all these variables in the dashboard that it's like, where do I start? Do I start here? Do I start there? What this treatment can do for that particular person, sometimes you just go out of the gate and because you're going to feel better. And I mean, you're going to feel better quickly. And what this will do for Dr. James, let's say, it's going to wipe a lot of lights off the dashboard. So to allow her to like, okay, now I got a clear picture. The liver's not working or the kidneys dysfunction, where before the liver, the kidney, the thyroid, and all of it was lit up. So it's going to make you feel better out of the gate, but it's going to allow her to kind of hone in on where to kind of tailor your treatment plan from there.
the next question, what can't this heal?
Nothing.
What can't?
I don't mean to say it like that. And it's not, again, that's why the one slide I said, you cannot think of this as, will help autism, will help Parkinson's. Yes, I can give you all the reasons and how it does it. But our body doesn't think of it that way. It's all it's thinking of is that I have this injury that led to this injury, to this insult, to now I have Parkinson's. Your body is just dealing with leaks in the dam. And what this is doing is basically plugging the leaks up to allow your body to heal itself.
The next question. Oh, sorry. I didn't mean to cut you off.
No.
The next question is, can it repair COVID heart damage?
I'm going to come back to this question because I have someone in studio, if you will, that she's traveling with me, and she's going to answer this. And she just got a treatment an hour ago. And I'll let her give you the short answer is yes. POTS, inflammatory COVID, long hauler, heart conditions. Yes. The short answer is yes. But she just had a treatment an hour ago and it's making her heart go all kind of crazy in a good way.
The next one is, how often is the treatment done? Is it only done in Texas? I'll take the second half of that. We're offering it in St. Louis. We will have it at our office in Detroit and likely Iowa. And then on your website, you actually have a list of all the physicians across the country that have it, correct?
Yes. How often? If you have systemic mystery disease, okay, or something autoimmune, autoinflammatory, chronic, I'm just going to let you know right now or autism, that you need to prepare yourself for a treatment every 8 to 12 weeks. A treatment every 8 to 12 weeks, and give yourself the mindset, I'm going to commit to 4 treatments. Why? Because we found out that there's 2 things: the benefits of what a single treatment will repair starts to plateau at about the 8 to 12 week mark. And there's a scientific reason that I can go into it, but I'll just trust me on that. And so any repairs that is made at that point, any unresolved repairs or immune things that is kicked out of your body is gone. It's fixed. So the virus that is gone. If it's out of the bloodstream, it's gone. If it's fixed the particular brain thing that you had, it's fixed. And so each treatment will build from that. it's rare that people don't experience benefits from the first treatment. It's rare. It's very common that people don't experience the benefit that they were expecting or wanting. And I have to say, listen, I understand that your knee hurts or your shoulder or your back pain. I get it, but your body simply doesn't care about the back pain because there's 5 other things that are actually probably causing the back pain. And so you get those people to come back and it's like, well, my back feels a little better, but I don't have the brain fog and, my tremors went away and I'm not depressed anymore. And I'm like, those are so much more better. So, can
I add one thing though, Tapley? Because we did have a number of people who came for pain and had significant improvement in their pain, like opioid dependent pain. I think we had 3 people with severe pain that they didn't get off their meds, but they were more controlled out of the gate.
Yeah, I mean, can you talk about that? Just like, will it reduce? I just want to say that many people walk in. Let me give you an example. I remember patient number 6. Her name was Quila. She was 86. She walked in. She came in because she had Parkinson's, and I was asking her a few questions, and it turns out she had lupus for 30 years and also rheumatoid arthritis. And I was like, oh my gosh. And so her memory was neurologically, it was 2 different people within 72 hours. She did a memory exam where on day 1, she remembered 1 out of 30 things. And by day 28, she remembered 27 out of 30 things. She came back 3 months later and the tremors had almost gone away, but they were still there. And she's like, well, I think it worked, but the tremors kind of came back. But I did want to tell you that my ANA counts from my lupus they're normal or negative for the first time in 30 years. And so I'm just trying to make people's expectation that in Quila, and again, this is patient number 6, and I didn't know what we had in the beginning. She almost thought the treatment was almost a failure. But she's like, oh, by the way, my ANA counts of lupus, I don't have it anymore. I'm like, oh my gosh. Well, so my point is that many people walk into the door with joint pain, but if you ask them a few questions, their problem is probably way beyond joint pain.
All right, you ready for the next one?
Yeah.
Is this legal in all states, and who is it administered by?
Okay, legal. Yeah, FDA has already ruled on stem cell therapies. If you're doing stem cell therapies from a donor, FDA doesn't like it. When it comes to blood, they don't care. As a matter of fact, they've ruled on that in their latest guidance. If they consider blood therapies and specifically PRP outside of the scope of regenerative medicine guidance. So
hands off.
Hands off.
So in our office, you have to be seen by myself or our PA, and then the nurses administer it. So that's how that works. Have you very exciting possibilities? It's always nice to read the compliments. Have you treated schizophrenia with this and had any positive results?
Yes. As a matter of fact, it was the sister of one of our doctors up in the Northeast. And to him, he's like, it was like a new person. His sister was like in her 50s or 60s.
Okay.
We did everything from suicide to lots of mental disorders. Help me out here. Well, yeah, but as far we treated a lot of mental disorders and seen in those, and what we call those, when people get this treatment, they often experience what we call the shift. And the shift is something that happens pretty quickly after the treatment. And what we've seen is that a lot of mental disorders, there's a lot of compounded emotional trauma built into it. Okay. And that emotional trauma, there's plenty of data on this, and how that affects our physical health is dramatic. And so you get to this point to where you remember that slide where I showed you inflammatory peripheral than neurological. If you were to overlap, how they've looked at our emotional state, if I'm in a state of where my parasympathetic nervous system is not firing, I'm in the state of where I feel loved, I feel grounded, I can feel empathy, I can connect to people. If I'm over here in the neurological category, that's where my sympathetic nervous system is cranked up. I'm in fight or flight. Your cells are in fight or flight. They're not thinking about love. They're not thinking about being connected. They feel depressed. They feel disconnected. They feel suicidal. And the shift is when you get this treatment and it puts out a lot of those inflammatory fires, people immediately, and I've got the videos, they're like, I feel alive. I feel this happiness. I feel this thing that I can't describe. So it's this deep soul type of healing. And that's really your sympathetic nervous system being shut off and your parasympathetic, the good one kind of being turned back on.
So I want to go back to the questions. I have a patient who's had the treatment. Jamie, do you want to comment or say anything? Do you want to share your experience? You wrote it in the chat. I'm not outing you.
No, you're good. Yeah, just having the first treatment, not knowing, having a clue what to expect because I didn't even understand I took your advice, kind of didn't understand the whole situation or what was even going on. He's right. The changes just in my mental being, as far as the settlement and being settled and calm and actually looking forward to things with having chronic Lyme and it kind of gotten out of control neurologically. It's amazing what the testimony. I've just listened to everybody else, and he's right. This is what has happened to me. The results have worked. Nothing else was working. And I know I've had it for at least 14 years. But as you know, in August, I had a severe, lapse from another tick bite. And I was going down tired, like quick. And it seems like Julie even told me today, my wife, that every day I'm getting stronger and there's more stuff happening that's better. She still sees improvement every day. So am I there yet? No. Have I seen great improvements? Unbelievable.
You didn't even tell me your handwriting had changed and you didn't notice you had a tremor. Was that you telling me that?
Well, I've always had a shake in my hand, but it had gotten so bad and my motor skills had gotten bad that you couldn't read my handwriting at all. And we were taking notes at a class and my wife looked over at me and said, I can read your whole handwriting. She couldn't believe it. And I hadn't even noticed it. I'm like, wow, I can read that. Like I never had, like for years, a year or two, I haven't had good penmanship at all. And so I type everything. And suddenly, not suddenly, but obviously as part of that neurologically, the brain fog's gone. My mental clarity's back. Still have ringing in the ears some still, but that'll hopefully keep going better in the future. So
cool. Thanks for sharing. Awesome. Yeah. The next question, if one already has a reactivated virus such as Epstein-Barr, can they still do this treatment?
I'm glad somebody asked that. Tell me shake your head when you can see this.
You got it.
Okay. This is a case report we did from one of our clinics in Dallas, and you can read the title. And basically the word negativization means not that the treatment helped lower the Epstein-Barr IgG, IgM numbers, but it completely removed it from the bloodstream. Okay. So we looked at 48 patients and we identified 18 of them that only had the TruDose. And we did blood pathogen panels on all 18 of these people because some of these other 48 had, vitamin C and other types of IV therapies, but we wanted to keep it clean to say, what did the TruDose do to them that nothing else can say it was the TruDose. And so these people had their blood pathogen panels done before the treatment and then 4 months later. And these were the results right here. See if I can highlight them for you. So negativization, Epstein-Barr, 7 of the 10 people that had it completely got wiped from their bloodstream. So it's no longer there. Cytomegalovirus, not to be, 4 out of 4. Candida, there was 35% improvement. Herpes, it's kind of a kill shot for herpes, whether you've had it for 30 years, 50 years. Now again, okay, there's mold and then Lyme. And so the one thing I want to hone people in on is this comment right here, is that if you have Epstein-Barr, you just don't have Epstein-Barr. And we have other blood data that you not only have possibly 3 of these things in you may have as many as probably 7, a combination of Lyme, COVID virus, cytomegalovirus, herpes 126, fungus, mold. So if you don't just have one, you have many. The good thing is that remember that information being reset. When you take this out and reset it, their days are done. Now it's going to go attack a lot of the stuff in the bloodstream first, because that's, the Lyme hiding out in your joint and your tissues. Once the stuff in the bloodstream comes out, then that stuff's going to percolate up, because, and then the next treatment, it's just going to progressively just start clearing stuff out.
The next question, any significant side effects?
No.
Can I add one?
Yeah, please go ahead.
So a couple of us on here had Herx reactions. So I think when you kill off Lyme and Epstein-Barr and all that, you get a flu-like reaction. I had it. Someone else had it. So yeah, it was fun. It was 24 hours, right? I just wasn't expecting it because I actually wasn't planning to do the treatment. I took a canceled spot. So, one of the reasons we recommend people to have a consult with us is to get testing for all of those, because very few doctors even test for them, so that we know ahead of time if you have reactivated Epstein-Barr, mycoplasma, any of those, so we can be ready and kind of pre-treat ahead of time, and then this can be the kill shot. So I just wanted to throw that in there, because if you don't expect that, or you don't know what it is, it can be frustrating and make you think that PRP made you sick.
No, I'm glad you did, because and if those of you don't know, herxing is actually a sign of just base of the body. Those are good signs. Those are in other worlds, they call that a healing crisis. That's your body going through the steps of the healing, and it's necessary. So it's not fun, but side effects like, bad stuff. If there's anything that, even people that have had cancers, people have been treated. I'm not going to go on and say treat cancer, but I've known people who have taken it on their initiative. They've had metastatic cancers, activated cancers, dormant cancers, and even it's only helped them. So, there really isn't any side effect. It's your own blood.
Next question, leukodystrophy. I missed the answer on leukodystrophy. What's the question on that? Can you type that in again? So I'll ask a question. What does the platelet count have to be? We have some patients who are thrombocytopenic. Where do they have to be with their platelet count to do this?
Well, those are the ones that that they're going to really need to take the papaya. And I mean, unless their platelet count is probably sub 100, they're going to be just fine. Okay. Which I haven't come across that yet.
Okay. The cost of one treatment.
So this is whether it's Texas or it's Oh, well, I mean, all of our clinics, I'm just saying as a general thing that I went around last year and I made sure that all the clinics were not charging anything less than 1,500 and not charging anything over 2,000. So if you went to any one of the clinics, that's probably what you're going to expect. Some of them were charging 3,000 and 5,000. And I'm like, listen, you can't do that. People can't afford that. And these people need help and they got to get it every 8 weeks. People can't do that. So to my knowledge, the majority of the clinics, and I want to say 95% of them, you're going to run into the $1,500 price range.
Okay, thank you. Is it a cure for Lyme or a treatment? I think we've kind of addressed that. How long would you see relief?
I'm going to have somebody jump on and answer that because she's sitting right here next to me. So I'm going to come back to that question.
The next one, so she was asking, she's a chiropractor who has a regenerative medicine clinic with an NP. So they would be able to offer this service, correct?
Yeah. We got a few of those.
Yeah. Have you treated burning mouth and a few months after the COVID vaccine side effects like neuropathy?
If it's the short answer, neuropathy, yeah, it helps them immediately. The feeling, sensation. I mean, I see that all the time, whether it's chemotherapy induced, whether it's COVID induced, whether it's diabetic induced. But if it's COVID induced, there's a dramatic, I mean, almost instantaneous sometimes before you even walk out of the office, you're feeling it better. It helps does it help neuropathy? Yes, it does.
The last one was, has it been used to treat leukodystrophy demyelination in the brain?
Okay. First of all, I had to look up, leukodystrophy and what that was. But you just said the key word was demyelination. And so I can't tell you that I'd have to look through the software and the data to say, has anybody treated leukodystrophy? It doesn't ring a bell. But the word that you just jumped at me was demyelination. Now that goes to the wheelhouse of that one growth factor that I said platelets carry around, which is brain-derived neurotrophic factor that is specifically responsible for remyelination. So it's going to be specifically responsible for resheathing the nerves and then also responsible for nerve growth. So I can't say that anybody's ever treated that, but if 1 + 1 = 2, then it makes sense to me.
All right. Let's see.
I hope I answered that adequately.
Oh, Brenda, do you want to comment on your experience?
I had mast cell and neuropathy for years. I didn't even realize mast cell because I kind of like the neuropathy pain was every bit as bad. And so I really didn't come on to the mast cell until this last year, that was part of the problem. But I have not had, mornings where I can't stand to get out of bed anymore. I'm getting up and moving.
Good. How often can you have the treatments done?
Okay, I'm gonna have this person step in right now because I'm gonna have her go back and answer the heart question, the Lyme question, is this the cure, and then how often do I get this done? So her name's Elena, and I'm happy to be traveling and she now works for my company. She had Lyme disease for 30 years. And I'll let you take it from there. But okay. If you can answer the heart question, Lyme, and then how often do you get this done?
Okay. Hello. Hi, Molly. So Lyme for about 30 years, systemic mast cell disease, I can track that all the way back down to being 16. POTS syndrome, all the herpes viruses, Epstein-Barr, mold illness, Hashimoto's, what am I missing? I was an EpiPen user. Everything threw me into anaphylactic shock. So
how many things have you tried?
I have been in all kinds of different treatments, Lyme protocols and treatments that nearly killed me. My only job was to get better. By the time I found this, I was emotionally exhausted and drained and wasn't sure I had the hope or the faith to try something else. I'd written my kids letters because I was so sick. And And this one doctor just kept pushing me with it. So I finally, was in contact with Tapley, came to Texas, tried the treatment, and I had the treatment on a Tuesday. On a Thursday, I went home in a very small plane. They closed the doors. The flight attendant walked by, and I instantly went into a panic. And that was the first time I had not had a mast cell reaction in many, many years. Because the smell of her perfume would have sent me to the ER. And since I started this a year and a half ago, I haven't had a reaction since. For the heart stuff, for me, the POTS really hit me with the tachycardia. I had a treatment earlier today in this clinic, and it used to always go to my head. And now it's the first treatment I have had that didn't happen, and it went straight to my heart. So the tachycardia is there. It's one of the symptoms. But I haven't had a POTS reaction since I started this, except only one, which was very, very minor. What else do you want me to talk about? Oh,
is this a cure?
Oh, and then, clinic-wise, I do these still every 8 to 12 weeks because I had so many decades of these conditions, and it just continuously keeps reversing every symptom I have. I have been symptom-free for over a year now.
And we've measured your blood. And
we've measured my blood, and at the antibody level, I no longer have any of the herpesviruses, and my Epstein-Barr is non-existent as well. I have a doctor who's pushing me to redo the Lyme test, so that's on the docket. I've got a neurologist who's following this because I do have something that I forgot about called MOG, which is on the National Rare Disease List, and that attacks the central nervous system and the optic nerve. But this treatment resolves all my flares within 24 hours, and I've only had one in a year and a half. And all these flares used to send me to bed for about 6 months at a time. I was actually in bed for about 6 years before I found all this. Now I'm working full time.
Yeah, dyslexia one.
Oh yes, no more. At 53, I am no longer dyslexic, which is the craziest thing. Things like the sneeze and pee after having kids, totally gone. I can go to an exercise class. Actually, I have the energy to go to an exercise class, and I don't have to worry about that anymore.
About how long? About how many treatments did it take before you're like, wow, I've got my life back? You know what I'm trying to say?
Okay, so after my first treatment, I had so many amazing things happen. My pain at week 3 was 80% gone, and that's not come back. My second treatment, I had a herx for about 8 weeks, but it was more fatigue and tired and kind of groggy. My third treatment, I felt incredible again, and every treatment just builds on the next. If I was told to do this once a quarter for the rest of my life, to stay like this, I would. I still do treatments every 8 weeks because, as I said earlier, my list of issues is quite long. But cognitively, everything has come back as well. My brain works better now than it ever has. My stamina is great. My energy level never seems to go away. I don't know what else.
So I think that
Does that cover it?
I think the heart, I mean, do you have Lyme anymore?
I haven't had a Lyme symptom in over a year and a half.
Okay. So
and the pain for me, I have the Lyme pain, bone pain, the bouncing pain from joint to joint, and none of that anymore.
So people always say cure, and I'm like, well, if it's not there, it's not there. And that's just not her, but we've done this to many other people who've had Lyme. Is it going to take one treatment? No, it's going to take multiple, but it's not like IVIG. It's not like some of the other things where this is your body being proactive. It's going on the offense, not the defense. This is healing your body. And so by resetting that information and saying, hey, Lyme, you're no longer hanging out in the joints. You're getting out of there. So each time it's pulling some of that stuff, it's kicking the anthill and going deeper and deeper, and to the point to where it's not there anymore. And we can measure that, and we know that. Thank you.
You're welcome.
She's handy to have around.
Thanks, Elena. Your story is awesome. It definitely inspired me.
And I'll be there. I'll be there in mid-December. I'm coming. Woohoo!
Have a good time. This is an important question. Pat has a patient with a severe allergy to heparin, like an anaphylactic reaction. Can this treatment be done with something other than heparin, or what are our options for that patient?
Yeah, we won't use heparin. We'll use something called acid citrate, dextrose. So no heparin.
Okay. Do we need to order special containers for her, or how does that work?
No.
Special kits? Okay, we can talk about that.
It comes. I mean, there's
Sodium
probably
citrate, is it?
Yeah, I mean that comes with the kit, so there's no heparin.
Okay. Tracy wants to say something. Go ahead.
Hi. So just a little bit about me. I've been a major autism mom and researcher for over 15 years, and we just recently met, me and Tapley. But I can tell you, just listening, all of this, it just blows everything that I've learned over the last 15 years out of the water. So I've spent probably a good hundreds of thousands of dollars on treatments for myself and my son. I was always sold on IV ozone therapy. And this really seems to top IV ozone therapy, in which I was, huge advocate for. I just got my treatment yesterday, but these treatments, stem cell therapy, I've been out of the country and done stem cell therapy for $15,000 a round, and where it's done nothing. So to those who are just learning about this kind of stuff, this is nothing short of amazing. So I'm super excited, and you can sign me up.
There is a question about let me share my screen. Let me just tell me when you see this. Just say, okay, I see it. Tell me when you can see it.
Yeah, we can see it.
Okay. So how is this for anybody who's had stem cells? Let me just show you this. This is the order in which our body heals anything and everything. Okay. This is the healing model, the healing cascade. It's an order your body doesn't deviate from. It doesn't. First, your body, these are fancy words to say your body right here identifies there as an injury, and then your body calls in your immune system. Okay. This is when your white blood, when you heal something, when you have you have a big scab and it starts itching, those are your mast cells actually going to work. So that's your immune system. And then the third step is I got to make sure there's blood flow there, because I don't care, what the injury is. If you don't have blood flow there, you can't get oxygen, you can't get nutrients. So the body makes sure that there's blood flow there. And then steps 4 and 5 is basically remodeling. Once these things are in these stages are set, then the body says, okay, let me activate stem cells from my knee, from my brain, from my shoulder, from my whatever, because now I have, everything is set. So what happens is that many of us are, and so you can see right here, there's a time clock in which your body gives. Let's say my son who got vaccine injured, His body activated this healing cascade, and look what's in charge of activating it, like we talked about earlier, right? So, oh, there's this massive injury to everything. Let me stimulate the immune system, the repair system to activate. Well, automatically, I got to make sure there's blood flow and all kinds of growth factors. So here's the problem. Once this time clock is done, and if the injury is not completed, it's repair of the brain, the shoulder, the whatever. What happens is, like I told you, your body will be stuck at a certain point in that inflammatory loop. And most of us are stuck right here. I'm going to put arrows right here in this inflammatory chronic loop. This is chronic inflammation right here. This is why we take Advil. Okay. It's like, that's a bad thing. Our body stimulates inflammation as part of the healing process. But if it's already gone through the healing cycle, then your body is signaling, help, I still didn't finish my repair. But the body says, look, man, I got other problems. You got to fend for yourself. And that's the tissue screaming, saying, I can't finish it. I can't repair it. It's stuck in chronic inflammation. So if I was to give stem cells, which are needed right here, into a body, let's call it, I'm going to take my son, who is stuck in chronic inflammatory loop. If I was to give him stem cells, then I've basically bypassed these first three critical order of events that the body has to undergo, wants to undergo, must undergo, to make sure the stem cells can actually get there. Because we all know that as the longer as tissue becomes chronically diseased, it increases the likelihood of it losing vasculature, it losing feeling, which is basically, nerves, because the nerves in your blood vessels go hand in hand anatomically. And so if there's no blood flow to get to the injured brain, the injured knee, the injured shoulder, you can stick a gazillion stem cells in there. They're not getting there because there's no blood flow to access the diseased tissue. So what you'll get is an inflammatory response that says, oh, these are stem cells from somebody else, and there will be some healing happening from that inflammatory response. But your next time you get the treatment, it'll be there'll be a point of diminishing returns. If you had all the money in the world, this is why I would not give my son stem cells unless they were stem cells for himself, but I wasn't going to do it to a 4-year-old. And this is why this treatment makes so much complete sense to me. Now, if you would catch somebody early in this process and gave them stem cells, they'll work. You catch somebody who's had a disease for 6 months, for a year, for a couple of years, you'll have diminishing returns. So I hope that made sense.
We are a bit over time, so can we rapid fire these last 3 questions and knock them out and then wrap up?
Yes.
So the first one is a treatment that has a code for insurance coverage?
No, I'm sorry.
I will add in insurance is legal money laundering, and they are not going to pay for anything that's going to stop making. Yeah. That's all you need to know about that. So unfortunately, all the things that are truly going to help you and heal and cure you of anything are never going to be covered by insurance because they have no benefit to do that. Could this treat AFib?
Yes.
Infertility?
Yes. That's actually one of the first things that I initially was set out to help. So I don't want to go into it, but I can, it's helped a lot of women who, ischemic ovarian syndrome, turns their ovary back on.
So, I'm going to wrap there. So if anybody's interested in doing this at our office, our first offering, our launch is going to be December 14th and 15th. That's a Thursday and Friday. You need to get an appointment in the next week or so to do that. If you're not already our patient, to get started on the papaya leaf extract and have your labs reviewed and all of that. We are charging the $1,500. We want to make this as accessible as possible so that people can benefit from the technology. So if that's the case, call tomorrow. Heather or Megan, Heather will get you on the schedule and we will get rocking and rolling. So Tapley, thank you so much. We're looking forward to having you and bringing this. We will have it in St. Louis to start with. We're going to try to get it into Iowa. And then we will be launching it in Detroit when we open our Detroit office in February. So, that's what we have to offer at our James Clinic.
Are you going to have it for just everybody or just a limited number of people on these treatment days?
Definitely there's a limit to how many we can do. And that's a question for you. How many? I think we did 10 or 12. No, we did 14 in a day. They were mostly adults. And so it went fairly smooth and we were done around 4. Yeah, we're probably going to be capped at like 20, right?
Yeah. I was basically saying you're not going to, if you wanted the spot that people need to call you so they could.
Yes, correct.
Okay.
And we already have, out of the 14 who did it before, most of them have already committed to doing it again. So,
okay.
The ones who got good results wanted to see how good it can get. And the ones who didn't notice it yet want to see it the next time. So, yeah. All right.
Thank you, Mollie.
Thanks, Tapley. We'll see you in a couple weeks. Thanks, everybody. Appreciate your time. I think they'll be emailed the recording.
Yes, I'll get the recording to you and let you get it out.
Okay, so we'll get that email to you. We will also make it available on our YouTube channel. I generally only email the links. Well, I don't know how we'll do that. It'll be on our YouTube channel as well. So if you want to share it with somebody you think could benefit, we're super censored. So please share this with people because when I post stuff, it doesn't get out there. So if you can think of 1 or 2 people that it can help, that would be wonderful. Signing off. Good night, everybody.